Hi, I'm Terrence Bird. At Health First New Jersey, we believe everyone should be informed about the important healthcare issues that affect them and their families. That's why Health First is proud to support programming produced by the Caucus Educational Corporation.
Funding for this edition of Caucus New Jersey has been provided by the Russell Berry Foundation, J.H. Cohn Accountants and Consultants. We turn expertise into results. Fedway Associates, Inc., and by the Christian Plumeri Foundation.
Public Broadcasting is thrilled for the first time to have Barry Ostrowsky, who is the President and Chief Executive Officer of Barnabas Health, be with us.
My
Good
pleasure.
to see you, Barry.
My pleasure. Thank you.
Is this, in fact, do you admit that this is, you're a lawyer, do you admit this is the first time you've been on PBS in this new capacity?
It is true. It is true, and I'm delighted to be here with you for sure.
It's good to have you. For years you've been on this side. You're a lawyer by training.
I am.
And healthcare has been a part of your life for a long time. Biggest challenges you see today facing not only Barnabas Health, but the entire healthcare community?
I think it's the balance between the necessary resources that we all have to have in order to produce the clinical care at a level of excellence that we all want. All the discussion is about, can we afford health care? And if so, how can we produce health care that's wonderful but affordable? And so I think the challenge for us to provide the health care is to ensure we have those resources. And frankly, there are challenges. Governments don't have the money they once had to produce those resources. Private employers don't have the resources they once had to produce the revenue we need. So for us, it's a challenge when the mission says produce wonderful care, and we know that requires a level of resource that isn't easily attainable. How do we balance that? So I think we're all fighting that fight.
I've had a long-standing relationship with Barnabas Health. Not only are they an underwriter of our programming, I've done some leadership coaching and seminars, hosted events as well, full disclosure. I've said it before about Barnabas Health. It's actually hard not to have a relationship in the healthcare community with Barnabas Health. But I want to ask you this. As a leader, as the new leader of Barnabas Health, you also went to the White House and talked to some of the folks who have been shaping national healthcare reform. Those discussions.
They were very interesting, and I appreciate your comments, Steve. I think whenever you try a transformative policy, such as the one health reform suggests, it would be good to incorporate in the thinking and the architecture folks that are active in the industry or attempting to transform. I think one of the disappointing aspects of the health reform process was that it didn't include folks that ran insurance companies, it didn't include privately practicing physicians, it didn't include those of us that run institutions, and frankly, it didn't include consumers.
Why not?
I'm not sure. I'm not sure whether the goal was to announce a significant transformative piece of legislation, or whether it was the goal to really try to do something that made sense at the practical level.
What did you say to them?
I said that I'm disappointed in that, and I suggested to the official who was helping to write this that I think whatever comes out of health reform is then going to have to be modified to accommodate what happens on the ground. And while I was assured that would be the case, I think that we still have differences between what is part of health reform and what is part of everyday delivery of health care. And so I think those challenges will continue for many years. And while the principles behind health reform, I think, are many that need to be vindicated, the question is this the form, is this health reform legislation practical in attaining those goals and objectives? And I'm not sure it is.
You know, we were at a meeting recently at North Beth, one of the many. By the way, real quick, 20 seconds on Barnabas Health. Describe it so people know what it entails right now.
Well, as you said, we're the biggest in New Jersey. We have 6 general acute care hospitals, St. Barnabas, Claramas, and the Beth in Newark. We have Monmouth Medical Center, Community Medical Center, and Kimball Medical Center. We have a psychiatric hospital, 2 children's hospitals, and a host of outpatient services. So we're very proud of what we have and, frankly, the care we deliver.
We were at North Beth. We were at a meeting, a community advisory board meeting, and the issue you were presenting for the first time in this capacity, and it struck me, you started talking about looking at healthcare in a different way, and you said, listen, I don't know how to describe it or brand it. You know I'm obsessed by the idea of branding. You said, I don't know if I like wellness, but we need to talk about a healthier way of living as opposed to dealing with sick people before they're sick. What's that obsession about?
Well, I think it's part of our mission. I think that's been a part of the mission that many of us in healthcare have ignored for far too long. We don't get to know you until typically you're sick. We have outstanding clinicians to treat you under those circumstances. And while from a business standpoint, it's counterintuitive to say, let's keep you healthy so we never see you as a customer, I think if we're going to be true to the mission, we're in the social service business, not simply the healthcare business, and we need to help people live better lives. And among the things we have to be able to convey is, how do you live a better life? And that's a pretty intrusive idea. People don't like to be told how to live. People don't like to be told what they're doing wrong. But I think if you develop a reputation for clinical excellence, as we have, and many others in the industry, then you have a platform and a level of credibility to say to folks, look, we're asking you to live better, not because it's in our best interest.
Because it may not be.
Exactly.
From a money point of view.
That's right. And so right now the challenge, I think, is multifold. One, is there a sufficient amount of resources so that we can invest in helping people live better lives?
Excuse me, Barry, you start talking about things like supermarkets.
Absolutely. I'm a strong believer in that. Newark Beth Israel Medical Center is in the South Ward of Newark. It's generally been described as a food desert.
Actually, you grew up in that area.
I did, and attended grammar school there. When I was there were supermarkets, many of them. Now, if you travel the area, there are no supermarkets. There's no access to fresh food. And I think that's our responsibility. So as part of this mission piece that we've kind of ignored, we have to go into that area and say, let us help support, develop, not only a food market, but let's talk about how we offer guidance on how to use the food. I'm excited about the proposition that in the Newark school system, there is an intra-network. So why not have our own food channel in the schools? Because, you know, chefs are now the new gods of the industry.
That's right.
Well, so let's do it. Let's put on our own food network. Let's talk to the children. Let's make sure they understand what we're talking about. Let's ask the parents to participate. This isn't a unique idea. This happens in other marketplaces, urban marketplaces around the country. We just haven't done it yet in Newark. And frankly, that's a commitment of ours to make that happen.
It's interesting, as the CEO of Barnabas Health, you've got to deal with everyday bottom line, pay your bills, pay your people, pay their health care, and deal with creative, imaginative, forward-thinking strategic initiatives.
Well, you flatter me by saying that I could do that.
No, I said that's the job.
Right, Zach. And in order to discharge the job, you need a great team, which I happen to have, and wonderful employees to about 19,000. So we have the infrastructure. We have to have the commitment, and we have to balance this issue of, do we have the resources to pursue this aspect of the mission? And I think we shall have those resources, but it's not going to happen overnight. And of course, what we're talking about will take generations to really be embedded in everyday life. You know, I don't think we can assume that a couple of cooking lessons are going to change the way people eat. We're going to have to stick with it. And one of the worries I have is, if we're going to launch this part of the mission, we're going to have to stick with it, and we're going to have to make sure that it starts to get traction. And that's not something you wake up one morning and say, wow, we did it. It's a lot of hard work. It's a lot of commitment. We have an urban farm at Newark Beth Israel Medical Center. It's become so popular that we're out now looking at a greenhouse. I didn't even know there was a market for used greenhouses. We're about to buy one and construct it on Lyons Avenue.
How
so
exciting.
that we're starting to go into the fresh food business. But we need to make it bigger. But I think it's a very exciting proposition.
You know, Barry, it's the first time you've been with us. I know it will not be the last. We've barely scratched the surface. Next time, we'll talk about the relationship with insurance companies.
I'd love it.
The expanding role of hospitals, getting into a whole range of other things. And would you mind if we talked about consolidating, mergers, and all kinds of other things as the marketplace evolves?
If we have to, I'd love to do it.
Okay, we'll do that. Thank you, Barry.
Thanks, Steve. Good to see
Congratulations.
you. Thanks so much. Thank you so much.
We'll be back right after this with another fascinating healthcare expert.
If you would like more information on this program, or if you'd like to express an opinion, email us at info@caucusnj.org and visit us online at caucusnj.org.
Chip Balix is founder and president of America's Grower Row. Good to see you, Chip.
Nice to see you. Thanks.
You've been with us many times. You are the 2010 winner of the Raspberry Make a Difference Award.
Yeah.
Tell folks exactly what that is.
It's a great program. It's where volunteers, unsung heroes, are essentially submitted by folks that they know for the good work that they've done within the community. And the Russell Berry Foundation has created this program where they're highlighted their successes and also cash awards for how they place in the final outcome of being picked.
The issue of philanthropy is huge with us, not only because we survive based on philanthropic organizations supporting us, but it's an important area and we focus on it big time here. One of the books that you know a lot about because you're featured in it, A Passion for Giving, Angelica Berry, one of the authors. There's a section, page 199, America's Grower Row, a feature, talking about your organization. Quote from you, expand on it. There's absolutely no reason why poverty should exist in America. Chip Palix. Talk about it because your organization started in 2002?
Correct, yes.
Lay it out there and then talk about that quote.
Well, the program started where my daughter and I started a garden. And through divine inspiration, we gave what was left over to food pantries and food banks. So what started very small back then, 120 pounds in 1 year, fast forward to last year, 325,000 pounds.
Ergo winning the Make a Difference award. So go ahead.
So, you know, my feeling is that there's a lot of waste, whether it be through gardens, on farms, and then also within supermarkets. So as the program has grown over time, we've touched those three elements where when we go to farms, we glean, which essentially means that we're picking what's left over. It's great produce that's on the plants and such. But when farmers plant, they plant in succession. So they go from one section to the next. Once it's all ripe, sometimes there's extra inventory in the fields. We make sure that's picked and delivered same day.
So no reason for poverty?
From that standpoint, from a hunger standpoint, we're just one farm. We're just one farm within the state of New Jersey and making a huge difference, touching a couple supermarkets as well. We do the same thing where the produce section, we cull out of any produce that's has a couple days left in terms of use by, but the sell by date might be today. So we pick it off the shelves, we bring it to the food pantry, the soup kitchen, and people are fed immediately.
In the book, you also talk about food deserts. What are they and why are they so significant to this discussion?
It's a relatively new term. And a food desert essentially is where you have a geographically designed area. It could be inner city, it could be rural, where there's zero access to any healthy food choices. And the people within those communities, even if they had the money to buy produce or healthy food, they just can't get there.
Patterson, Newark, or Jersey City, Camden, et cetera. You mean supermarkets?
A lot of these communities just have little corner store markets where they don't have produce. And so what we're doing is we're getting into those areas, we're penetrating, and we're creating what we call free farm markets.
Free what?
Farm markets.
Farm market, go ahead. Describe that.
Basically what it is, it's like a traditional farm market. We pack up our trucks, we go down into the community. It could be a community square, and we lay out all different 5 to 7 different varieties of produce. And you know, the folks of the community come in and they have their bags. We give them recyclable bags that come each week. You know, they pick up, "Hi, Mrs. Jones, how you doing today?" And of course, she takes what she wants. The only difference is when she gets to the end of the line, there's no cashier because it's free. So it gives them the ability to at least consume some healthy food within an area that, again, they just don't have the ability. Some of the folks come up, they've got oxygen tanks and other limitations. So it's our way of being able to get what they need.
Chip, we met each other through the Make a Difference Awards, I remember at Ramapo when I first met you, and blown away by your work and the work of so many other unsung heroes who are recognized. And I think to myself, you know, how do you keep the passion? Because the book's called Passion for Giving. How do you keep your passion for this work, for your mission, for giving?
The passion is really driven through the reward. And the reward is seeing the happy faces, people saying, "Please come back again. I need this. I need this food for my family. I need it for myself." The reward is also seeing our youth, I'll call it the privileged youth that are not suffering from hunger and within food insecure situations, where they say, "Wow, this made a difference in my life by just volunteering."
Yeah, talk about the volunteer piece.
We have a myriad of volunteer sources. It could be schools, it's corporations.
By the way, put up Chip's website if you could, because I want to make sure that if people want to volunteer, they can. And describe what we mean by volunteer, Chip.
Well, our volunteering it's a lot of fun. It's a day out on the farm. It's where volunteers come out and then perhaps they plant, maybe they harvest and then donate. Some folks come out, plant, maintain, harvest, donate, and they round out the whole experience. So it's a very moving piece, especially for our youth. So when schools come out and do this, knowing that they put all this time and intention into something, and at the end, they don't consume it by eating it themselves. The joy they get is by giving it to someone who needs it more than they do.
Your daughter been into this with you?
Since day one.
How old is she now?
She's 13.
What's it done for her?
You know what? It's changed her life. Not that she was different back when she was a dyke, but the long-lasting effect is clear. She is so focused about giving to those who are in need, and all the youth that I see that touch the program always want to come back. So we think it's developing a healthier generation in the future.
Real quick, sorry for interrupting. Before I let you out of here, what's the message you want to share with everyone watching right now who says, hey, got that guy Chip Palix, that's terrific that he's doing that. He won that award for $50,000 with the Russ Berry Make a Difference awards. That's terrific, but yeah, that's not me. I can't do that. You say?
There's no one who's excluded, and everyone who touches the program can make some sort of impact. You know, it could be a matter of just coming in and volunteering for an hour. It could be more committed and coming in each week. You could serve by perhaps stuffing envelopes. We're a nonprofit organization. There's always a million things where someone can help us.
Chip, we are honored by your presence. We are blown away by your work, and you have an open invitation to come back anytime. We appreciate it. Thank you.
Great. Thanks so much, Steve. Great to be here.
Stay with us. We'll be right back right after this. Some pretty amazing people here. Thank you, Chip.
Thanks.
If you would like more information on this program, or if you'd like to express an opinion, email us at info@caucusnj.org and visit us online at caucusnj.org. Richard P. Miller is the CEO of Virtua. Good to see you, Rich.
Good to be here, Steve.
It's an important conversation we're having about healthcare. Let me give you a quote. By the way, before I do that, I'm going to give a sense of Virtua. 8,400 clinical and administrative personnel.
Correct, yes.
1,800 physicians serving medical staff, right?
Yes.
Huge.
Huge. Largest employer in South Jersey, Steve.
25 years?
25 years with the organization.
That's what that pin says, right?
That's exactly right.
But what's interesting here, before we get into the whole baby boomer discussion, you have said that baby boomers really expect a lot more. I want to talk a little bit about this. One of the things that it struck me, and we talked about in our roundtable with the Commissioner of Health, Mary O'Dowd, and some others, our good friend Annette Catino and Barry Ostrowsky from Barnabas. We talked about this a little bit then, but I want to get more in depth. You've talked about the fact that the use of social media is huge in so many ways, not just from a marketing and promotional point of view, but to serve consumers. Talk about it.
Well, I think social media is very important, the use of Facebook and Twitter in getting health messages out to the community, because even people in my generation, I'm a boomer, are using social media to communicate today. Recently, I tell you a story, Steve. Recently, I was on a train going from New Jersey to Philadelphia, and it was in the morning. When I was younger, everybody was talking to each other. Everybody on that train was linked in to some form of social media. So people are communicating differently today. The millennials, the boomers, we have to understand that and be part of that.
But what does that have to do with healthcare?
It has a lot to do with healthcare.
Break that down. Give us a concrete example of how Twitter, Facebook, as part of the Virtua world, could actually help healthcare consumers.
Well, for example, Virtua has created an app, Virtua app, that people can put on their iPhone now and really get and find physicians, find health and wellness programs, find our fitness centers. They can blog with other people that may have a disease that they'd like to talk to. So it has a lot of applications for health. It has a lot of applications for sick care. And that's the way people communicate. So it's very important that we include those in our form of communication.
I also know one more quickie here. You've created your own network online.
Yes.
With health-related videos. Also, our production company is working with
Yes.
yours as well to provide a lot of those videos, news articles as well. Why is that the role of a healthcare organization to provide that kind of information?
Well, I think the healthcare model's changing in this country, Steve. I think we're going to be responsible as a healthcare provider, not only for the sick, but we're going to be responsible for people prior to getting sick. The role of a healthcare provider in the future is to keep people out of the hospital, to keep people out of the office with illness. The goal is to keep them well and prevent illness. It's a major change in culture for a healthcare provider such as Virtua or any healthcare provider across the country.
Let's get into that because we talked about it in our roundtable with the Commissioner of Health, Mary O'Dowd. But one of the things that came up, and I want you to talk about it, is if you're currently paid, and I think you were the one in the group who brought it up, if you're currently paid for fee for service, I come into Virtua, I'm sick, you get paid for me being sick, clinical care, equipment, whatever it is, right?
Correct.
If I'm not there, you don't get paid.
Correct.
So then what the heck are you doing being involved in prevention?
Because I think eventually, Steve, what's going to happen is we're going to see a payment model completely shift where there may be one payment for a whole series of care points. In other words,
Care points.
Care points meaning primary care, hospital care, home health, long-term care. So a provider of health care may receive a certain amount of money to provide all those component parts of health care.
By whom?
By an insurer,
right.
that may be interested in saying, we can't pay what we're paying today, so we're going to look at how you can provide health care differently. That will cause providers of care to think of the care process differently and look at health and wellness as a major component of that, because frankly, you want to keep people out of your hospital setting.
Rich, when you talk to your colleagues, you know, not just other CEOs of healthcare systems, but others, how worried, concerned, and how much do you think about January of 2014 and the coming of national healthcare reform?
I think I'm concerned, and the reason I'd be concerned is I'm concerned about access points, for example, in New Jersey. There's a lot of struggling hospitals out there right now that aren't capable of making these type of investments we're talking about, whether it be in technology, whether it be in diagnostic technology, IT, so
wellness and prevention.
So they're in the model right now just providing care day to day to patients, which is fine, but that's not going to be the model of the future. So I'm concerned, will there be access in certain parts of the state for inpatient care or models of care that could be provided in certain locations, but maybe not in others?
What happens to them?
Well, I think what's going to happen is we're going to see more consolidation of hospitals and healthcare organizations coming together to provide services. It may not be a total merger of healthcare providers, Steve, but it'll be for service niches. For example, you know, if a hospital needs a wellness center in their marketplace, do they partner with a Virtua? You know, if a hospital needs other types of primary care services in their market, do they partner with a Virtua to help provide those things? I think those discussions have been initiated in some parts of the state. We'll see more of them.
You know, I have to ask you something. I do this with every CEO who comes on. It's not so much a healthcare related issue, but you know that I'm fascinated by the question of leadership and succession planning and how people develop their teams. I'm a student of it. And when you do this kind of work and you meet interesting people, I'm curious about it. How do you describe your leadership style? Because your organization keeps growing, your challenges keep getting greater, and there's not only can't you do it all, you shouldn't be doing it all. How the heck do you manage and lead that team?
Well, I've managed by listening, frankly, Steve. That's been my style for 25 years. And I try to take from people what they think the direction we should be going in as an organization to provide care. I try to put some strategy, big strategy issues to my people and say, now let's talk about this and tell me how we define this. So it's a listening process for a CEO to understand where our people, my people, want to go and what direction they want to go, and understanding that the economics are changing.
But you're also developing other people to step up, because as Virtua grows, isn't it fair to say, because when you took me on the tour, when you were opening up in Voorhees, right?
Correct.
Huge, right?
Big project.
Big deal. A lot of jobs.
A lot of jobs.
Economic development. I remember the governor came there. It was a big deal, right? You had to have people ready to step in, take over, right?
Correct.
You had to get... You're developing people to be leaders.
Right. We educate.
Are you always doing that?
Always, because there always has to be a succession plan in an organization to bring people through the organization to lead. Because frankly, Rich Miller's not going to be there someday, Steve. You know, I have to make sure that the culture and the idea generation in the organization continues.
40 seconds, real quick. Baby boomers, their demands greater?
Demands are much greater. I'm a baby boomer, Steve. I will tell you. My demands are much different than my parents. My mother used to go into her physician, give a prescription. Mom said, great. I used to ask Mom, what's it for? She says it doesn't matter because the doctor gave it to me.
Now?
I'm asking different questions. What's the drug interaction? You know, what's the long-term effects of the drug? You know, what should I be doing differently? The boomer asks more questions. We're more impatient. We don't like to wait. Consumerism is more an issue for the boomer.
We have to respond. Rich, I want to thank you very much. Virtua is growing. And by the way, congratulations on 25 years. We have a big party coming up.
Yes.
Looking forward to being there. Thank you very much, Rich.
Thanks, Steve. Thank you so much. Appreciate it.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 20 years of broadcast excellence. N13 4WNET, NJTV, and WHYY. Funding for this edition of Caucus, New Jersey has been provided by the Russell Berry Foundation, J.H. Cohn Accountants and Consultants. We turn expertise into results. Fedway Associates, Inc., and by the Christian Plumeri Foundation. Promotional support provided by NJ Biz, All Business, All New Jersey, and the Star Ledger and NJ.com, Everything Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus, New Jersey has been produced in partnership with TriStar Studios.
Hello, I'm Rafael P. Roman.
And I'm Steve Adubato.
Join us every week on New Jersey Capitol Report.
Because we'll ask the questions that you want and need answered.
Airing on NJTV, 13, and WHYY. Check your local listings.